start with this. Good morning to you. We are going to embark on a subject that is painful because ADHD children are completely normal and they can be recovered completely. Will you give a hand clap for that? Yeah. We are going to do this interactively. So we are going to do this interactively, and you have to own the program because you will be the caregivers in our model. Parents will be the ones or the siblings who will really help in healing up this child. So as you see, right learning and recovering childhood is a theme of our seminar. Allied and parallel seminar would be, on which I'll be touching today, what happens to the child after the age of 12? The pathogenesis of ADHD, that is how ADHD develops, has to do with what happened in the mother's womb plus what happens to the child up to the age of 12. So in my understanding, at least 60 to 65% of the contribution into ADHD comes from digital abuse and overuse. Then when the child is passing 12, 13, 14, you have to think of what kind of career and curriculum is this child capable of. If you understood that, just give a wave of your hand. Yeah, we are going to be interactive, okay? Just give a wave of your hand. Before the age of 12, how to manage the child's digital health. After the age of 12, your child having gone through some of this digital aberration or some other procedures that affect his brain tracts, how do I best deal with my child in his curriculum, career, choices and character? Give a wave of hand if you understood this. Yeah. You will not be sitting and absorbing, you will be sitting and acting, okay? So you are going to believe that what you are doing here is going to have a take-home effect for your child. That's why we are here, isn't it? You are either personally concerned or you are concerned for someone else. You are professionally involved with children who have learning difficulties. Today's seminar will concentrate only on ADHD and ADD. This is not about autism. Autism is a completely different subject. But we'll be touching on other childhood entities which was mentioned earlier, which may mimic ADHD, which may get misdiagnosed as ADHD. I need a wave of hand again. Okay, yeah. This is a very emotional topic. You need to get passionate. Sitting on your seat, you will not absorb the subject. Okay? Now, my normal subject is pharmacology. I especially specialized in epilepsy, Parkinsonism, aspirin-like drugs, and so on. So when I lecture to medical students, I don't ask them to wave the hand. I ask them to keep their brain alert. But this subject involves brain and heart. So you need to wave the hands and smile and poke each other and help ourselves along the way. Second slide will show you the three main components of ADHD when doctors diagnose. Inattention, can we say that together? Inattention, impulsivity, hyperactivity. They are self-explanatory. Child's inattention is not merely due to the fact that the child is interested in other things, but there is a basic inattention problem. When child does not get attention in the womb and soon after birth, child will not grasp attention. So you are thinking through. That's why this needs complete interaction. I repeat, when the child does not get attention, either in the mother's womb or soon after birth, the first critical years, child will not learn attention. So how the mother responds to the child in the womb affects the growing child in the womb. If you know that, will you just put up your hand up? So for medicine for at least a century or half a century has known a syndrome called maternal deprivation syndrome, which means if for some reason mother feels deprived, child will feel the deprivation. Now, child will not know who made the mother feel deprived, whether the father made the mother feel deprived or not, the child will not know. That's a good thing, isn't it? Child does not know what's... Can you smile also a little at the same time? Child does not know what troubled the mother. But child knows mother is troubled. This is known to medicine for a long time. When we were medical students, we were taught this. Besides this, what is now known is every kind of injury to the mother, that gets translated into chemical molecules that can cross the child's blood-brain barrier. Molecules cross the child's blood-brain barrier. You know that. Molecules, chemical molecules, cross the child's blood-brain barrier while the child is in the mother's womb. Will cross the mother's placenta. And in the first 6.5 months of the child, up to about almost the 26th week, child's blood-brain barrier, the fetal blood-brain barrier, absorbs stuff very easily from the mother's blood circulation. Okay? So when mother has emotional stress, trauma, either because her best friend is not her best friend, or she's watching awful stuff on the television, or she's playing dangerous digital games, or she's listening to violent music that's nearly killing her, but she's enjoying it. But those molecules that are being formed in her brain and in her endocrine organs, cortisol, dopamine in the brain, serotonin in the brain, will get into her blood and will cross the mother's placenta into the little fellow's brain. This is what medicine, when I was a student, did not know. Now it is known. So mother must watch what she watches during her pregnancy, what she watches on the digital screen, what she practices as digital craft will affect the child. Okay. Now it is known, and about 8 months ago, the British Pediatric Association made a medical and an academic pronouncement that mothers should not take any level of alcohol at any stage of pregnancy. Because the alcohol molecule, C2H5OH, is a very lipophilic molecule, meaning it likes fat. And it easily crosses the mother's placenta and alters how the brain is wiring on the little fellow, in the little fellow. There has been a debate at least for 20, 30 years about this, but the obstetricians and gynecologists would not tell the mother, don't take alcohol. But now the British Pediatric Association has finally got approval to say mother should not take any level of alcohol during the child's pregnancy, when pregnant. So, which is a great step forward. Now the social customs began to greatly change in 1970. That's the time ladies began to drink C2H5OH, which is alcohol, more frequently, you know. With that, 1970 is the watershed from which time autism, ADHD and other many learning difficulties began to appear. Okay? Yes. So, attention. We come back to attention. So, baby feels it in the womb, and when the child is born and mother takes the child to the breast and the child begins to recognize mother's heartbeat as the most important influence that was there for the child when the child was in the womb. Lub-dub, 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 lub-dub. And when the child is born and the mother is breastfeeding the child recognizes the familiar rhythm. And that causes tremendous bonding. Then of course the mother takes the child, and the first 3 weeks the child can't see, but the child can hear. So mother says goo, and the child goes goo, and the two together make the google.com. That's how attention is given, attention is grasped, and intelligence is made. Now I have to tell you, first attention is spiritual. Child knows, this is my mother. Second attention is emotional. Third attention is intellectual. If you got it, just give a wave of hand. Spiritual attention that the mother's spirit can give the child. Emotional attention that the mother's heart gives the child. And intellectual interaction and attention the mother's brain gives the child. That's easy, isn't it? I'm giving you time so that you completely absorb, and at the end of this seminar you know all what I know. But then you have to practice what you know. So seminar is slow, you absorb and you make decisions while you are seated here. How many of you are here as mothers? Because you're a mother, you're here because of that concern. Okay. How many of you, just to be fair, how many of you are here as fathers? Because for the first question, obviously you couldn't have put your hand up. Isn't it? We know the distinction between male and female, we know. Okay, smile a little. I mean, this is a happy seminar, this is an interactive seminar. Don't be glum, just smile a little, okay? Of course, it's a professional seminar, but we can smile a little. How many of you are here as caregivers in this field? Okay, so I get a pitch of who is here for, I can pitch it accordingly. So attention. Child grasps attention as the child gets attention. Main thesis I am making. So if the child didn't get attention in the womb or soon after birth, child doesn't learn attention. Child doesn't grasp attention. Then child gets inattention. He can't get what you didn't give, what parents didn't give, the child can't get. So attention is a received gift. Parents have to be attentive on their children. And attention that parents give, nobody else can give. Agreed? And attention that mother gives and the attention that father gives, it has to come like that because the design is like that. You learn more about it later. Or quickly to say it now, mother makes it secure for the child every day, every hour. Mother is about securing the plot now. She is a gatherer and grower every day for the child. I'm using some technical language. The father is the one who helps the child in the next step. Just put your foot forward and say, next step. Yeah. Now, you know that mothers can't teach fathers. Have you learned the lesson or not? Yeah. Yeah. So fathers here must learn it now. Or if they are not here and you need them to learn this, when my friend Ron arranges the next seminar, you can get them to come here. Meanwhile, don't browbeat them into submission, it doesn't work. So, what father gives the child the strength for the next step. When does your child's next step come? Pinch your neighbor and say, every day. Child's next step comes every day.